Nonprofit organizations and other groups that provide care to the disabled are raising concerns about their staffing levels as New York tries to move more patients out of institutions and back into the community. The members of the Be Fair to Direct Care Coalition say that low wages make it very hard to attract and retain workers, but they cannot give raises without help from the state. So earlier this year, they launched the 300 Days to Better Pay campaign, which has held events around New York. Here to talk more about that, we have Steve Kroll of New York State ARC and Kirk of Schenectady ARC. Thank you so much for being here. I really appreciate it. It's good to see both of you.
Thanks, good to see you.
So first of all, this issue is not new. I mean, this issue first came up when we were having the debate about raising the hourly wage in New York. And and you should correct me if I'm wrong, but you cannot give a raise unless the state renegotiates Medicaid reimbursement. Is that right?
That's correct. There are about 100,000 direct support professionals in the state, and the vast majority of them work for not-for-profit agencies. And so the Be Fair to Direct Care Coalition is made up of all the not-for-profit agencies in the state. And we support somewhere around 100,000 people with developmental disabilities, and that means we support them in all types of settings. So we provide residential settings where they live, we help them with employment, we help them getting their medical needs taken care of, we help them with recreation, we help them with meaningful day activities for people that don't work. And we have direct support professionals that are the people that provide the day-to-day support and care and mentorship for them. They are generally paid much below what other competitive wages are.
So what is that on average?
So on average, we pay we start people between $9.50 and $11.50 an hour, and that's what we can afford because of what Medicaid pays.
And that's less than minimum wage, isn't
Well, it's less than what the minimum wage is going to.
Right.
And we haven't had a meaningful increase in 8 years. So Kirk could tell you about it from the local standpoint,
Yeah.
but a few years ago, our wages were competitive. We were paying more than other people, but because we haven't seen a meaningful increase, other jobs have passed us by, and people are leaving our workforce to go to other places.
Okay, so we're now in August. I had to think about that. And the session ended in June, which wasn't that long ago, but seems like an eternity because we've had a lot of political upheaval since then at the national level. So remind me, I thought that this was addressed in some way, not your specific issue, but did the governor not address and the legislature the nonprofit problem in addressing the minimum wage when they decided to go to 15 and or 12.50, et cetera, depending on where you are in the state?
Not really, because our crisis is today. We have openings, about 10% vacancy rate across the state. We have about a 20% turnover rate annually of employees leaving. And so we're in a crisis place today. And we need to have our employees getting a living wage, the people that provide support for people. These are not minimum wage jobs. And they're earning barely above what the minimum wage is today. And they need to earn a living wage because we see people leaving today for other jobs that are not nearly as sophisticated and hard because they can do better for themselves economically.
Okay, so tell us what is the situation at the local level, Kirk, in Schenectady?
We are close to a crisis. Right now we have 100 vacancies. We have 600 employees if we're fully staffed. Right now we have 100 openings, and 98 of those openings are with our direct support positions. They're not administrative. They're not, ancillary.
Dealing directly with people.
Yes,
yep.
Absolutely.
So 600 fully staffed. You have about so you're at 500 then?
Yes.
Okay, that is a problem. So what are you doing? You're paying overtime, I would assume.
We're paying overtime. We have managers who are working in direct support positions. Well,
are they trained to do that?
Oh yeah.
Okay.
Most of our managers came from the ranks of our direct support professionals, but we have. What we're doing is we're burning out our workforce. It's a Friday afternoon. I have staff who will sit for 4 hours trying to put together schedules so we have coverage and adequate people to ensure safety and well-being over the weekend. So we have a serious problem, and we're losing people to the state. We're losing people to other private providers.
But how can you afford to pay overtime if you can't afford to give people raises?
We can't afford not to pay overtime. So we end up either cutting in other areas. We might run a deficit. You can't do the calculus where you take what you would have paid in overtime and say, all right, well, we'll reinvest that and raise our wages, and that'll fix the problem. It's not enough.
But the state, first, if you had your druthers, you talk about a living wage, Steve, what does that mean? Would you pay people more than $15 an hour if you could? How high should the reimbursement rate be?
Well, we do want to get to a living wage, and what a living wage means, and the state has got calculations of what a living wage is, and you'll hear it talked about even by the governor in the minimum wage debate, what it takes for somebody to be able to pay their bills, to be able to pay their rent, to be able to support their family, to buy food. Right now, we have people who are starting out, and Kirk used the example of his starting employees that started at around $9 an hour. And that's not a living wage. $9 an hour works out to about $17,000 a year. You can't raise a family on that. You can't support yourself on that.
If I remember correctly, when we were having this discussion about nonprofits, writ large, not specifically your organizations, the governor said, well, nonprofits need to take a hard look at themselves because they're bloated at the top.
Yes.
So are you
we
wealthy?
bloated at the top? No, we're not wealthy. If you look at our administrative expenses, we run at 8 to 9%. So 92 to 93 cents out of every dollar we get goes to our programs. The governor had that concern. He issued Executive Order 38.
I remember.
He put caps on executive compensation. I'm not close to that cap.
For nonprofits that do business with the state.
For
right,
nonprofits
right.
who receive Medicaid funding.
Yeah.
Yes, it covers all of us. And so, the governor took care of that. And I don't, there were some outliers, there were some bad examples, but in my experience and in the professionals that I've worked with, we are not bloated, we are not wealthy. And there's not, you could take my salary and just eliminate it if I did nothing.
Well, how many
and
people
it would
could you hire?
3, maybe 4. You'd add maybe, but look at our workforce. Maybe you'd add 15 cents an hour to our workforce.
How much time do you have? You say that you're near crisis. For the entire system, how much time do you have? Because the legislature doesn't get back until January.
Well, we need to see action this year. So we started in June, the 300 Days to Better Pay campaign. We started having events across the state, and we're going to have events across the state for the rest of the summer, throughout the fall, trying to highlight this issue. We're getting families involved. We're getting legislators who are champions involved. We're reaching out to even more legislators to get more champions involved. We're getting our direct support professionals involved. This is going to be an issue for us in the election. We have 100,000 people with families. We have 100,000 direct support professionals. Those are a lot of people that vote in New York State. We need them to become active, and we're going to be putting out a report card on where people stand that are running for election and whether they support us or not. And our goal is to have the governor put in his budget a meaningful increase after 8 years with no meaningful increases, and to put us on a 6-year plan towards a living wage.
Okay, so there's a dollar amount that you're seeking?
There will be a dollar amount that we're seeking, and we can come back and talk to you about that as we get towards the fall and give you sort of the specifics of the plan.
So have you had any conversations with the executive at this point?
Well, we've been getting conversations as, conversations never really stop.
Well,
We've been
right,
working
okay,
with them
because they're
over
starting to
summer.
put together
And
the budget.
they're already starting to put together the budget. And what we want them to do is to put us on a plan forward so that we can start to reduce the vacancies, start to be able to get out and hire people. And we're at a point right now where the sustainability of the entire field is in jeopardy. There is we've been here to talk with you about before, for example, the lack of residential opportunities for people. If you were to say today that the state would create more residential opportunities for people, we would tell you we couldn't staff them because we don't even have enough staff to take care of the people we have today. And what this is about is the health and safety and well-being and the ability of people to live in communities. If we have to cut down the amount of staff that are in a program, that means that there's less choice for the people in those programs. And our whole mission is to help people live meaningful lives in the community to be able to achieve their goals.
Okay. Unfortunately, we're out of time. You want to make a final point?
We have a tremendous workforce, and the people who work for us do it because of the work and the difference they make in people's lives. So we need just a little more respect for that workforce as reflected in what we can pay them, and we will be fine. But it's so you said, do we have time? If we get some positive movement, we certainly have time, because we have great workers who are committed to the work they do, but they can't keep sacrificing their own lives and their families' lives, and when they see the private employers, the fast food places, paying $2 or $3 more an hour than what they're getting. It's not respectful.
Well, it is a story that, as you mentioned, we've had conversations about. We'll continue to do so. I thank you so much for your time this evening.
Thank you for having us. We're very active on social media at #BeFair for Direct Care. We would love to have people come and join us.